Hello, my name is Emma Hunniford, and I am a senior athletic training student at Florida Gulf Coast University, and today I will be conducting a cranial nerve assessment. So the first part of this assessment would be to test the olfactory nerve, which would utilize either like an alcohol rub swipe or something like of that nature with a pungent smell so that they can define it. So I'd have the patient close their eyes. I would take the wipe out of the packet and kind of wave it in front of their nose and have them identify what the smell would look like. And then the second part would be testing the optic nerve. We would utilize a Snellen eye chart that would be posted against the wall in an office, or you could even have them read some, text a little bit far away from their eyes. This would test for the optic nerve. Obviously, if they could not read these lines, then that would be a positive for this test. Next, we would test the ocular motor nerve, number 3, with a light response. So we would use either a pen light or a light from the doctor's office. Just looking for the pupillary response. Have them look at you and shine the light in them, and if their pupils are strict, then that would be perfect. The next aspect of this cranial nerve testing would be the star pattern that we would utilize to test 3 different nerves: the ocular motor, trochlear, and also the abducens nerve. So for time's sake, we would just use a star pattern and also an in and out motion to test all 3 nerves at once. So if you look at me, make sure the patient is looking at your finger and you just not move their head, just looks. So you go up and down, and horizontal motion, as well as in and out. Perfect. And the next part would be to test the trigeminal nerve. So I would have them kind of palpate their jaw, and then clench their jaw and smile at the same time. Perfect. Next, I would be testing the facial nerve. So I would have them smile, frown, puff their cheeks out. This one we would be looking for any atrophy on one side of the face versus the other, any abnormality. And then the next step would be testing the vestibular cochlear nerve. So I would have them close their eyes. Can you hear that? Can you hear that? Perfect. The second part of the vestibular cochlear nerve testing would be the balance test. So I would have the patient put both of their feet together, and I would observe if they could balance with their eyes open and also with their eyes closed. So have them stay closed and do this for about 10 seconds. The next part of this test, you would be testing pretty much 2 different nerves at once, vagus and the glossopharyngeal. The only difference between the 2, glossopharyngeal, would have taste added to it that normally isn't tested in a quick cranial nerve assessment, but can be if you wanted to distinguish between the 2. So this one, I would have the patient swallow, just observe the trachea and all that, and also say ah. Good job. So number 11, we would test the spinal accessory nerve. I would have them shrug shoulders against my resistance. So go ahead and do that. Good. Again, looking for any atrophy, any weakness in the muscles. I'm going to have you look this way. I'm going to resist you. Go ahead and rotate your neck and the other side. Awesome. And then the final step in this cranial assessment would be to test the hypoglossal nerve. So can I have you stick out your tongue and move it side to side? Good. That's it.